And I've worked with a lot of collaborators who've been able to bring their insights in terms of food retail marketing, in terms of population nutrition and community engagement, to come up with solutions that enable retailers to provide healthier food, to market healthier food preferentially, and to price healthier food preferentially. I'm Professor Anna Peeters. I'm currently the Chief Executive Officer of VicHealth, which is Victoria's health promotion agency in Victoria, Australia. I'm also a public health researcher of over 20 years and currently hold a National Health and Medical Research Council investigator grant. I started out doing my PhD in the transcriptional regulation of HIV-1, so very firmly a bench scientist, really excited by genetic virology, always with an eye on what does this mean for people, for population health, but really firmly focused on the lab. And after I did that, I thought I really love research. I really love trying to help find solutions to these really major global problems, but I'd really like to think about people more. And so after that, I moved into public health and retrained a little bit in that direction and got super interested in how do we produce evidence that allows policymakers to really make sure that the care that is offered to people in the health system is evidence-based, informed and equitable. And so equity came in quite early in my career. After quite a few years working in epidemiology and public health, I went to the Netherlands and continued my training there, which was a fantastic 4-year experience where I brought together things like demography, modelling and epidemiology and public health, and really started then to think about what are the bigger picture problems I might be able to contribute to as an academic. And so I came back to Australia really focused on building collaborations and collective impact and public health outcomes, and shifted much closer to population health outcomes and implementation in my research. And so in the past 5 to 10 years, I've been really focused on what's the evidence that we need to gather with government stakeholders, community stakeholders, industry stakeholders to shift the food system in a direction that enables much better dietary outcomes for all Victorians. One of the most exciting areas of research that I've developed over the last 5 to 10 years has been really focused on how do we deliver healthier food retail. So what that means is what's the evidence we need to put in place the policy, the tools, the practice that will shift our food retail environment. So that's like our supermarkets, our corner stores, the kiosks in our recreation centres and our hospitals to provide much healthier food. And the reason for this is because if our environments can shift to provide much healthier food as the default, then individuals don't have to make so many decisions about what they eat, when they eat it, and how to make sure that they and their families are eating healthier food to prevent chronic disease down the track. So for me, that's become one of the pivotal questions, and I've been really lucky to lead 2 NHMRC Centre of Research Excellences called Refresh, so Retail Environments for Healthier Food Environments. And that's been a really great experience. And I've worked with a lot of collaborators who've been able to bring their insights in terms of food retail marketing, in terms of population nutrition and community engagement, to come up with solutions that enable retailers to provide healthier food, to market healthier food preferentially, and to price healthier food preferentially. I've been really lucky to be funded by a wide range of organisations. So they're some of the usual ones like the National Health and Medical Research Council, the Australian Research Council, National Heart Foundation, and then some local ones including VicHealth, Cancer Council, Victoria, and then a number of government, federal and state level grants and tenders. And I think that really speaks to my interest in collaboration. So I've been really focused on collaborating across a lot of different community organisations. So I've done a lot of partnership work with local councils, local hospitals, community organisations, NGOs, really focused on how can we use our collective knowledge and expertise to drive changes to food environments. And then one of the areas that really emerged as kind of novel and interesting was how do we work with food retailers? So they might be the owner of the local kiosk in the local swimming centre or the manager of the cafe in your local hospital. But we've developed some fantastic collaborations with them and used their know-how to look at how do we shift those environments to preferentially providing healthier food while still being actually a robust business, so a viable business, and having lots of customer and consumer satisfaction. I'm really clearly focused on what can I contribute that can shift the experience of as many people as possible, particularly those experiencing the most disadvantage, to having healthier outcomes, so better health and wellbeing. And so that focus on improvements in health and wellbeing, using evidence and a focus on equity are really what drive me. I've got lots of interest outside of work. I really enjoy things like reading, going for walks, hiking, cooking, and particularly socialising with friends and family.